country that are negative. So thank you for your answer. Thank you, Mr. Chairman.
Senator Casey.
Mr. Chairman, thanks for having this hearing. I want to thank you and the ranking member for convening us. And I want to thank both of our witnesses for their testimony and their public service. I wanted to start with Deputy Assistant Secretary Neese to talk about bullying and harassment, one aspect of this larger challenge. I think we can all agree that children deserve to go to school without any fear or intimidation, but as we know, far too often bullying and harassment affect so many children and can have very serious consequences for the mental health that stay with them for the rest of their lives, and it undermines their ability to achieve academically. We know that these issues are especially prevalent among students with disabilities, LGBTQ plus students, students of color, and students who are either in high school or elementary school, girls and young women. So to support the well-being of all students, I've introduced multiple times now the Safe Schools Improvement Act, which would require school districts to adopt codes of conduct that explicitly and transparently prohibit bullying and harassment based upon race, color, national origin, sex, disability, sexual orientation, gender identity, and religion, very much consistent with our civil rights statutes. The bill would ensure that school districts take proactive action to support the safety and inclusion of all children. Deputy Assistant Secretary, what's the value of universal prevention strategies, such as legislation like I just outlined, in supporting mental health and academic achievement of every student?
Senator, thank you for that question, and thank you for... Is that better? There we go. Sorry. Thank you for that question. I think the department has partnered with the Department of Health and Human Services on a website called stopbullying.gov, which includes resources for schools to do exactly what you're saying. I think one of the reasons we are so proud of the Bipartisan Safer Communities Act and the work we're doing to increase the supply of mental health professionals who are in school is to make those things real. It's important to have the culture of a school be conducive to learning and safe for everyone. And we want to have those resources in schools and available to schools so that they can actually act on it. So I couldn't agree with you more. The need for us to address the bullying, particularly of vulnerable kids, kids with disabilities, kids who may have uncertainty at home. We want school to be that safe place where they always know that there's somebody there who has their back.
Thank you. I wanted to move to a question for Dr. Murthy. One of the many pieces of data that you cite in your testimony, and I'm looking at page 1 of your written testimony, it just kind of leaps off the page, and I'm just reading in pertinent part here. In 2021, nearly 1 in 5 high school students reported making a suicide plan. Hard to comprehend those numbers, 1 in 5 high school students. And I wanted to not just focus on those high school years, but what happens afterwards as well. And because if that's the circumstance in high school, we can only imagine what that means down the road. This challenge that we were all talking about here today predated, obviously, the pandemic, but was made much worse by it. I'm citing here the Kaiser Family Foundation showing that half of young adults ages 18 to 24 reported anxiety and depression symptoms this year, 2023, half of young adults. Despite these rising needs, many institutions of higher education are poorly equipped to handle the mental health needs of students. I've introduced the Higher Education Mental Health Act along with Senator Kaine. The legislation promotes collaboration among educators, students, parents, advocates, and communities to study the mental health concerns facing children. How can institutions of higher education better support students who are struggling with mental health today?
Well, thank you, Senator, and I appreciate your leadership on this issue and with your proposed legislation. I think institutions of higher learning have a huge role to play. First of all, they're where a lot of young people are, and we've got to bring the care to where people are. They can help to change culture by starting conversation addressing stigma. They can increase access to mental health services on campus and through telehealth to make it easy for kids to get care. But they can also invest in building the kind of connection and community that we know is vital to the mental health of children. It doesn't just happen by throwing kids in a room and saying, hey, mingle and build connection. It turns out a little bit of structure, along with a little bit of time, can help kids actually build the relationships that they want. And finally, let's just keep in mind, many kids don't have what we might assume are just basic tools for managing emotions, building strong, healthy relationships. Many of them may not have gotten that. And so we've got to recognize that. And it's why I think programs that focus on building social skills and an emotional development so kids can manage their emotions and understand the emotions of others are really vital. That's a life skill that to me is just as important as learning how to read or write.
Thanks very much.
Senator Cassidy.
I defer to Senator Budd.
Thank you, Senator.